1 billion people are going to die from AIDS.
The lifestyle of some male homosexuals has triggered an epidemic.
The scientists say this probably means they are dealing with some new deadly sexually transmitted disease.
Congress wants to know what to do about AIDS. Victims of the disease say the government has done nothing and has no plan to.
1989. As the AIDS pandemic spread across the country, those living with AIDS and medical professionals alike found themselves fighting not only against the disease, but against a powerful opposition of bigotry, ignorance, and fear.
If the homosexuals would stop what they're doing, an end would be put to all future cases of AIDS.
The AIDS Coalition to Unleash Power, or ACT UP, was founded in New York by Larry Kramer and soon grew into a national movement, fighting against the hatred, ignorance, and discrimination preventing the progress in AIDS treatment and solutions. Nowhere was the spiteful bigotry more fierce than in the southern states, the Bible Belt, featuring a long history of racism and homophobia. The city of Shreveport, located in the northwest corner of Louisiana and in the heart of the Deep South, would become a battleground for the fair and humane treatment of people dying of AIDS, as well as civil equality for homosexual men and women. What started as dinner conversation between three activists, Chuck Selber, Gary Cathy, and Joe DeSantis, soon grew into a powerful local ACT UP chapter. They became a force for change on not only the local level, but on the state and national scene. This is the story of fighting back in a small town in the Deep South. This is the story of ACT UP Shreveport.
I first learned of AIDS and HIV through CNN. And of course, at that time, it was mainly port cities that were having cases, San Francisco, New York, Houston, but not in the middle America.
It was a national problem, and we were seeing it starting to happen here at home. And we were seeing our friends pass away. They would get very thin, with no explanation, and the next thing we had heard, they had passed away. So we had realized that AIDS had come to Shreveport.
Oftentimes people would appear to be healthy, and then a few days later they would be dead because they were dying from PCP, pneumocystis carinii pneumonia, which would fill your lungs with fluid and you couldn't breathe and you were dead. So it was shocking to turn around and then find out that someone you just saw a day or so ago had died. It's devastating. And you just thought, well, my time is any day now.
You suddenly had people on a path that were ripped off the path of their own careers and their own lives. The biggest tragedy is we lost so many talented people that we really needed them. They're not here for us anymore.
My lover passed away from AIDS, and it was a very long and lingering, painful, excruciating, inhumane death. It changed my life forever. I don't think any human should go through that. No one should go through that kind of pain.
That was our world, day in, day out. Because tragically, we lost all these people.
Typically, a national crisis would galvanize the people and their government to take action and attack the problem. Sadly, this was not the case with the AIDS pandemic.
This is during a time when, if you saw a religious leader talking about the subject, they were saying it was something that God was doing to us. It was a way that God was punishing us specifically in our nation in general.
Very angry. Very angry that our president would not utter the word AIDS until his friend Rock Hudson came down with the disease. Years later, after thousands and thousands of Americans had died from this disease.
There was a lack of medications. Dr. Spurlock was the only person for many years treating people with HIV and AIDS in not only Northwest Louisiana, but probably North Louisiana and East Texas, if I remember correctly.
Whether it's people trying to promote sexual education, HIV-related activity, a progressive political agenda, much harder here. But still necessary. Even more necessary because nobody else is willing to step up to the forefront.
It's all judgment. It's all of those negative words that sum up one thing, which, you know, the things that people that are the most fearful of is when they become angry and they're acting out against it and doing all those things. And so it was an awful time.
People were being met at the door in hazmat suits. Completely unnecessary. Strict isolation. I actually saw a non-professional, a skilled assistant throw a patient's feeding tray into the room on the floor because she wasn't going in there because she might get it. I actually heard a registered nurse say, this patient has a clean case of AIDS because she got it from a transfusion, not from sex. As a clinician and as a human, I was appalled. And that's when I got really involved. We've got to do a better job of education. It was just an incredible amount of naivete, an incredible lack of education, and a lot of unfounded fear.
Horrors was what y'all don't really know that we went through, because you just saw individual cases and nobody died peacefully. Not really.
The AIDS epidemic was what forced the issue for so many people to be out. And it becomes linked not just because a lot of gay people had it, but because there's no way to separate it from gay history and what it pushed.
Now, you're the one who's interfering with speech right now.
I don't the GMAC or whatever AIDS PIP operation is paying you.
You're making the same point George Bush.
Plague! We are in the middle of a fucking plague, and you behave like this. Plague! 40 million infected people is a fucking plague.
Larry has had an incredible impact on my life because he modeled for me a behavior that you don't just sit back and die, or either let people that you love die without trying to do something to fight back.
It had to be somewhere in 1989 when Chuck Selber and Joe DeSantis had come back from New York.
Chuck Selber, born in Shreveport, was a playwright in New York City and volunteer at the Gay Men's Health Crisis. There he met Larry Kramer, the founder of ACT UP. When Chuck Selber was diagnosed with HIV, he moved back to Shreveport to be with his family, fearing he had little time remaining. Joe DeSantis was a Shreveport native, artist and actor with an early diagnosis of AIDS. He used his art to promote AIDS awareness prior to the formation of ACT UP Shreveport. Gary Cathy, raised in the small town of Minden, Louisiana, was an accomplished artist and clothing designer living in New York City. Gary got to know Larry Kramer, founder of ACT UP, while volunteering at the Gay Men's Health Crisis. As with many gay men, Gary was convinced he was HIV positive, and with no test available to verify his status, he moved home to Minden to be with his family and prepare to die, only to discover he was HIV negative.
One of the first people I called when I got back to Shreveport, of course, was Chuck Selber. And he had been organizing a little bit.
Well, Joe DeSantis and Chuck Selber and I were friends. All of us had a bond. All of us had something that tied us together because we had all left the Shreveport area and had lived outside in New York or California, and that we were back here now, and that drew us together. But our common sensibility and disgust at what was happening with the treatment of AIDS patients and the silence that there was in Shreveport about how you contracted it, what the funding that was needed for education, so many things. And we found ourselves here at a table at George's one night, late at night. And I tell you, we were here for hours, but the outcome of that was, after us just complaining about Shreveport and complaining about North Louisiana and complaining, and acknowledging that ACT UP was happening in New York and that people out in other places, if we were only there, we could do something. And it dawned on us that we can be an ACT UP chapter. The three of us could be an ACT UP chapter.
Gary Cathy had been an ACT UP New York member. So he was coming home, settling in here, and saw, look, this is how we need to handle it.
Debbie Allen said, hey, you want to go to this meeting with me? You know, it's all these cool people, and we're going to talk about HIV and AIDS, and they need some help. So that's where it all started.
And I believe that first meeting, there were 7 people that showed up.
It was a group of concerned, sick individuals, and I remember I was only 25 at the time, but I was one of the oldest. There were some young folks who cared and who were not infected, HIV negative, who were involved. And that's one of the clearest memories I have, is that there were these wonderful souls who weren't directly infected, but who were affected and became involved. So anyone who wanted to become involved and try to make a change was welcome. There was a lot of anger among us. We were sharing war stories. This doctor refused to see me. We tried to go get help from this group of people, and they closed the door on us.
We called another meeting, and I believe there was about 14 people at that meeting, and we felt really empowered that we were growing.
There was a lot of agenda and passion about what they were doing. It never seemed like a meeting because people got along. They made jokes, they laughed, they were very real with each other, they cried on each other's shoulders if they had to.
And I believe it was the third meeting that was called, that was at a public place. It was at
Shoney's.
Yeah. And Chuck Chuck put this big ACT UP sign right at the front door with an arrow pointing for everyone to go to the room. And there were, as best I remember, that third meeting, there were 35 people. And I remember walking through the door thinking, oh my goodness, it shows how little people know here, because if anybody knew in management at Shoney's or any of these other patrons knew what that was, somebody would be saying something.
That's so funny, because I booked that first meeting at Shoney's, and they were, what kind of group are you? A book club? And I went, yeah, that sounds good. They thought we were a book club.
ACT UP Shreveport was like any other ACT UP chapter. We were fighting for our lives, and we were just desperate for any kind of hope that we could find, and we were out there beating the bushes, and anyone that stood in our way, we tried to run them over.
Well, as far as I'm concerned, it was the foundation was compassion and trying to help the people that were getting sick and that needed help, be it treatment or medications, or if they were being discriminated against.
AIDS services were not available for people in North Louisiana. People in South Louisiana were having what services they did have cut.
I think the ultimate immediate goal was to save lives, because there were people out there that needed medicine that didn't have access to it, that needed medical providers that actually knew what they were doing and weren't like afraid of their patients or weren't judging their patients, that were just giving them medical care. So the immediate goal was to save lives on a local level.
We had all felt an urgency for a long time before we ever had that first meeting.
We wanted them to think differently about HIV and AIDS. We wanted them to be supportive. We wanted them to join us in saying, we need compassion, we need care, we need concern.
My friends were dying, and I just couldn't. It was the only option. It was the only choice. There was no other choice.
We, of course, modeled ourselves after ACT UP New York and ACT UP San Francisco. We would get their materials and read them and see what they were doing. People would call us AIDS victims, and of course we didn't like that, because that meant that you were powerless. And we took our power back, and we refused to be called victims. We were AIDS activists, or people living with AIDS, living being the word.
I thought everybody was going to get involved in it, it just made sense, because we were being treated different, and whether or not you were HIV positive or had AIDS or not, you were treated like you had some kind of plague back then.
I like what Martin Luther King When you stand up straight, nobody can ride your back. And that's what those people are doing.
It just seemed like the right thing to do. I didn't know anything else to do except for join it and get involved.
We had to pay attention to national stuff as well, but locally services, people being fired from their jobs for having AIDS, people being discriminated in housing.
But it was about the bigger picture, to try to get it in the paper, to try to get it on TV, to try to get people to talk about it, to try to even have the discussion, because we did not see that was happening on a local level.
Back then we wanted our voices heard, and whatever it took to get those voices heard, we did. Whether that was getting in someone's face, someone with authority, and questioning them, or raising our voice to get attention.
We would use methods like boycotts. We would use methods like, I think we called it phone bombing or something, where we would just call them hundreds of times in a day. We would have actions, protest, where we would get out there with signs, do all kinds of things just to get media attention.
I would say I always saw ACT UP as a protest organization, and that is after the fact to me. I tried to be more proactive in my life. The methods of loudly shouting down people, it's not me, not my personal style. I am a teacher deep in my soul, and I believe that education brings about behavioral change, not shouting.
It was very important that we attack this problem from within and from the outside. Of course, ACT UP was on the outside, and then there were many of those in the professional community, in social services and the medical community, who acted from within and supported our actions.
And I had to fight all the time, but you had to be strong, couldn't be weak. Weakness is not an acceptable characteristic of this disorder. It doesn't do you well.
I don't think anybody ever stormed the building first. There was always an attempt to open a channel of communication, to have dialogue, just to call the hospital and go, this is wrong, what you're doing is wrong.
I feel that the gay community had every right in the world to fight back in the best way that they knew possible, to call attention to the general public. But this is happening right here in our local hospital.
They became the experts about HIV and AIDS in North Louisiana, but they were still kind of shunned by the medical community because of their aggressive nature, or just because they were ACT UP Shreveport and they wanted to talk to people about AIDS.
We were a group of individuals. We all had our different personalities, different tactics, different times.
As Hillary Clinton said, it takes a village. That we all needed to bring our skills to the table. Whatever your skill is, and you're willing to give it, we'll use it. There were other people that just went and visited people in the hospital. Other people that drove people around town. Those are just as big of heroes to me as anybody else.
I felt like the straight people that got it had an obligation to their gay brothers and sisters to get out there.
You don't have to be gay, you don't have to be Nelly, you don't have to be Butch, everybody's affected by it. I didn't see ACT UP as a gay thing, I saw it as a HIV/AIDS thing.
Even though it was, gay cancer, it was pretty clear that it was not limited to the gay community, that it was spreading among intravenous drug users, it was spreading in ethnic communities, it was just still spreading.
But other than a handful of allies, everyone was standing in our way.
When it gets down to it, we were a group of rational individuals come together to do what was right.
Thoughts of ourselves did not enter into it. It was almost like you're going to war.
Specific information. As a dying man, Dr. Shaw, I am sharing with you what I feel is very important. I understand. And this is my only chance.
LSU was always a closed door to us. They were not interested in drug trials. The clinic was the last in the state to come about, and that only happened because we forced them. We embarrassed them. We made front page embarrassing them about the fact that they had no heart, basically.
ACT UP, AIDS Coalition to Unleash Power, says the LSU School of Medicine in Shreveport has turned down research money twice.
Chuck was wanting to to demonstrate at a meeting. There were healthcare professionals there, and Chuck had some issues with the way that that they were conducting themselves.
Healthcare workers went in the room. They were all dressed out, masks, gloves, yellow gowns, booties. It was over the top. Housekeeping wouldn't go in and clean the room sometimes, so stuff would be in the shower. You take off. It'd be built up in the bathroom. The dirty linen would be in there, and you'd have to go in there and take it out if you've been there. Sometimes I would do overtime. I'd work 3 days overtime. I'd be off. The linen's still in the bathroom when you come back if you take that patient. Of course, how they labeled the specimens. I thought that was horrible too. Going down when they're taking it down to the lab, all labeled and read and in a big biohazard. I thought that was horrific. And not answering the call bell when the patient called, sometimes, and they said, Sharon, I've been calling for hours, you got here, I'm glad you're here, stuff like that.
This was at a time when to go into the room, you fully masked, fully gloved, everything. And I would find myself in the room with patients who were needing to be cleaned up from having an accident in their bed, and would clean them up because the nurses wouldn't come, wouldn't be answering the call.
Didn't get bed baths, like they were supposed to, if they were supposed to get bed bath. And yeah, that's true. The tray, the food tray, they're all of our patients then were kind of in an isolation room. So this left it in the ante room. That's the room you enter before you. The trays were left in the ante room, so there's a lunch tray and a breakfast tray. They all may be there because they never did make it in there, especially if the patient was sick enough not to get up and walk.
Hospitals where they're supposed to have more knowledge of medicine and how this virus is transmitted, it was ridiculous, the fear around it.
Don Mathis, when he got sick, he had to go to a public hospital, and we sat with him, and I remember they put him in his own private room, and we hardly ever saw a nurse or anybody that would come in, and a lot of times we had to do stuff for him, like help change his clothes and feed him, and if he soiled himself, we would do that, because I think a lot of people were just scared. They didn't know.
There's evidence-based medicine, which even by the late 80s, we had a very good idea of how transmission occurred. So there's evidence-based medicine about what we know is the nature of the virus, and then there's what people actually believe, and the two don't necessarily correspond.
Joey had gotten hepatitis, and that's what had gotten him. And he had ascites. His stomach was out to here. They did no home planning for him. They discharged him. He had no hospital bed. So if you're in a regular bed with a belly out to here, you're suffocating. They didn't have side rails. We just had a regular bed, and he rolled out of bed, and we could not get him. He's big. He was 6'2". He was a big guy, and we couldn't lift him up and get him back in bed. So we called the fire department to come help us. And, we shared with them the information. He is HIV positive. Well, here comes this big parade of caregivers, and they were all in hazmat suits, and, the neighbors are all coming out, and you're mortified, you're embarrassed. And I was so angry. I spent more time being angry I probably should have been more of a teacher, but instead I was just angry about the whole thing, and, so I probably got in a fight with the fire department over that. I think I did, about them not having the education to know that just a pair of gloves would be fine.
If the healthcare community had sought education in a much more timely manner, it would have not allowed for so much rage. And it took real fights to get healthcare in this town to wake up.
And also, at the time that I was in ACT UP, we already knew enough about the virus to know that it wasn't airborne. This was already 1990, 91. We already knew how the virus was transmitted. So there was no excuse for behaving with such ignorance, especially as a medical professional.
There are 3 of us, Joe DeSantis, myself, and Gary Cathy stormed the LSU meeting.
And when things didn't go just right, then we started really pushing back, and we were thrown out of the meeting. and Chuck had a photographer reporter outside the door. And so as I was coming out, and Debbie I think is right behind me, there was a flash went off, and then we stayed outside the meeting for a good while talking to the reporter about why we were there, what we were doing, and that the whole point of our organization was to bring awareness locally to something that was happening locally. I got in my pickup truck and started driving back to Mendon that night, and the thought went, I had the radio on, and it started. The breaking news was that they were we were invading Panama, and I thought to myself, well, that'll take us off the front page. Not that I even assumed that we'd be on the front page, but I thought after myself, well, that'll take us off the front page because that's going to be the important news. And yet, if you go back, if memory serves me correct, if you look at that page, it's all about the invasion of Panama above the fold, but below that, they, to their credit, printed the logo of ACT UP and silence equals death. And there was a picture of us coming out of the meeting and a respectable article about what was happening there.
In response to these atrocities, ACT UP Shreveport initiated a series of actions against LSU Medical Center to bring better care to AIDS patients.
They wanted to put up giant neon signs that this is the viral disease clinic or the AIDS clinic. And I kept pointing out to them, and administration got it. Medical staff did not, why you wouldn't do that. And I've tried trying to point out to them, even in New Orleans where we had the huge population and probably the best clinic in the state at C100, it was called the C100 clinic. It was not, there was no signs that lit up and flashed and said this was the viral disease clinic. Frankly, at that point in time, lots of people would have lost their jobs and their families, and it was wholly inappropriate. The treatment, medical clinical treatment, was probably moving in the right direction, but the staff was ignorant, and I don't blame the staff. There was not enough education going on there, but to treat, no clinician should treat a patient as if they are untouchable. They believed that HIV was airborne at one point in time in their knowledge search, and did talk about installing giant exhaust fans from those patients' rooms or running that air from those patients' rooms through ultraviolet light to kill the virus. Unbelievable. Looking at it in large, however, I will say that some of the infectious disease physicians at LSU at the time scared me to death. They were the ones who wanted the giant neon signs.
Well, I recall a meeting at LSU Medical Center with the acting chancellor at the time.
When we moved into the office, Kurt arranged our seating where we were seated right straight in front of Dr. McDonald, who was the chancellor. And Dr. McDonald was very short and terse and to the point that he was treating AIDS patients just as well as any patient that came into the place.
Kurt Pickett joined ACT UP as a teenager, and although he was HIV negative, Kurt soon became a spokesperson for ACT UP Shreveport.
And I remember Kurt Pickett getting in the chancellor's face, and Kurt couldn't have been over 16 years old at the time, but extremely mature, and later become Dr. Kurt Pickett.
Kurt jerked up. I couldn't see his face. He was seated over here to the right of me, but I could hear his voice. And he said, "Doctor, I want to know right now, are you condescending me?" And the poor doctor turned red in the face, and he wanted to come back with something nice, and he couldn't. And when Kurt realized the point he made and how it was taken, then he lambasted the hospital, the chancellor, and unless some change was made in their attitude toward AIDS patients, they would have to deal with him on a daily basis. I thought, get on, boy, get on. I loved it. I loved every minute of it.
And it was that kind of attitude that cut through the BS and we got down to the brass knuckles of it all.
Wow, Kurt, an amazing individual.
Oh man, this guy had it all going though. You know, he had education, he knew the numbers, he had compassion, but if you were opposite of him, he would let you have it, and he would strike down he would find the fault in any argument and state his case.
Kurt Pickett was the youngest of us. I think I was the second youngest, but also such a great speaker, and he spoke with such power and conviction that we would like to put him in front of the press as much as possible.
His gift for learning about social issues and being able to just rip them apart and understand them to their depth and why this works like this and what needs to change. And just driven beyond what any normal person could conceive.
He had a wisdom beyond his years.
Also, I definitely miss talking with him. He was just always so engaged. He was so in touch politically. He was so in touch with what was going on in the community and at his work. And he always had such an unusual, unique perspective on things. And it was always an education to be around him.
That young man had fire. Integrity. Intelligence. The integrity is unmatched. Let's stop, guys, for a minute.
He used to say that he knew that his contributions to the scientific community would be a small brick in the wall of man's knowledge, and he was happy with that. He was happy to make that contribution, and I think that that's how he viewed his role throughout his life with, you know, the activism, all of the work that he did over the years in the different places that he lived was just taking little steps to try to make a difference. Kurt's forever a part of me, you know, and I'm fundamentally changed in countless ways. There's no doubt in my mind.
Not heeding the warning of ACT UP, and after continued mistreatment of AIDS patients, ACT UP would publicly demand the resignation of the LSU Medical Center chancellor. LSU Medical Center was just one example of the medical mistreatment of AIDS patients in Northwest Louisiana. Other service providers became the focus of ACT UP's rage.
LSU turned down AIDS research money on 2 occasions, and they turned down participating in drug trials for AIDS patients 2 times.
The only place that we could get AZT was a drugstore out on the Mansfield Road. He couldn't get a dental appointment. No dentist would see him. He wanted to go to an ophthalmologist, and one would see him after hours because people were afraid. They were all scared.
And the next thing I know, we got a call that he had been picked up, and he told the jailers that he was HIV positive. So they isolated him, and when we went the next day to pick him up, he shared with me that they had put him in a cell, isolated, and then they came in there and they urinated on him, treated him horribly.
Joe DeSantis was a wild card. He was very outspoken. He would be the first person up in someone's face.
He had so much life, you know. When he was around my children, he was a little kid, you know. If he was on that dance floor, he was the most handsome guy out there.
He was a gift to the world. He really was.
I love Joe, and he was someone that time and time again, through our friendship, really tried to help me.
What I miss the most about Joey is his wit.
Yeah.
He could make me laugh when nobody else could make me laugh.
He contributed a lot to my enjoyment in life. in the years before ACT UP ever started.
He gave really good hugs.
And big laughs.
Yes.
He was fun.
When he lived with me, we would meet in the hall, going one way and he'd be going another. And he'd pat me on the head and he'd say, "I love you, Pookie." And I think of that every day. Yes. I miss him very much. Very much.
Despite their best efforts to bring attention and understanding of the pandemic to the public, ACT UP continuously met resistance from several fronts, including their own community.
The worst sides of people come out, and they certainly did in this, when we were living in an area and a community that is as conservative as any place in the country and had the most virulent, toxic, hateful reactions to people with AIDS as you'd find anywhere.
That's Louisiana, or in the 80s, and people would drop by and throw rocks at us, because we were across the street from that Tops Western World, and it was, you never knew what you were going to get when you walked out to your car in the parking lot.
I used to get phone calls at home from the Grand Dragon of the Ku Klux Klan telling me I would be beaten and murdered in public square. And eventually I did have a home invasion, and I was beaten within an inch of my life.
David Duke was running for governor of our state, and Gary, Kathy, and I, we decided to go to a David Duke event in Minden.
To the rally for David Duke and hold up our signs and demonstrate against David Duke. When we got there, it was a little sobering.
There were no other protesters.
We saw the crowd that was there. And we reevaluated whether that was the time and that was the place to stake our stand and to stand out there in front of the people that were there to cheer David Duke, whether that was really the place that we needed to pull our signs out and do what we did.
Left the signs there and decided to go in. It was just stunning to look around the room and see faces of people from Minden and Sibley that I knew.
I think that's a good example to explain that there were even those of us who were the most willing to take a stand were cowed into silence over and over and over again.
It just didn't seem like the right time. You just have to choose your battles. And I didn't feel like it was, I didn't feel like it was an act of cowardice or a failure. I just thought we went to join in the protest that we assumed was going to be there. We hadn't set out to create a protest. We went in, and that to me, that took a little courage also, just to go and stand among people that you really, really disagreed with.
Oh gosh, yeah. The KKK rally in front of the courthouse where we had the same-sex kissing, that really stands out.
What I thought was that I gave him permission to kiss someone else, permission in our relationship. We're saying it's okay. If he wanted to do it, he was probably going to do it anyway. But to say I'm okay with you doing it with someone else.
At the KKK rally where ACT UP was protesting, I remember a lot of people in front of the courthouse, and there were a bunch of Klansmen speaking. And we were more towards the sidewalk and that huge statue in the middle of the courtyard that had the Confederate flag.
I mean, we almost ensued a riot. I mean, those KKKers were coming towards us, and the police had to stop them. So yeah, that was the most dangerous one action we had, I think.
And oddly enough, or ironically enough, sadly enough, it would be members within the gay community that would ask us to back off. And we just said no.
ACT UP was very controversial, and most people living in Shreveport, there's a reason they were living in Shreveport. They wanted to stay safe, closeted. They didn't want anyone to know. People who wanted to be open and honest about their lifestyle, about who they were, moved to larger cities, Dallas, Houston, New York, and they got out. And that took our best and brightest folks away from Shreveport, and most of those have never returned.
And being in the newspaper and talking about AIDS, it was shining light on that there was a gay community in Shreveport and that there were gay activists in Shreveport.
We were shining a spotlight on the negative, on what was perceived as the negative, the gay man's disease.
They were afraid of being outed or afraid of being victim of stigma, so they were against us because out of fear, I think, a lot of it. Not out so much out of hate, but out of fear.
It was 20 years ago, and being gay or being discovered gay or lesbian was still scandalous. You know, it was still a scandal in the press.
The gay community didn't like ACT UP Shreveport because they thought we were giving them a bad name. We were making trouble. You know, we weren't there to make trouble. We're in a desperate situation. You know, we couldn't just sweep it under the rug. It wasn't going to go away.
Yeah, they hate us because we were outrageous and we were angry and we did things that were socially unacceptable, and to do all those things, you know, to bring focus on this problem.
That mentality, that closeted mentality that looked down upon those of us who were out there speaking our mind, saying we're gay, we have AIDS.
It's a lot more fun to plan an Easter bonnet party than to talk about people dying. It's a lot more fun to think about which drag queen you're going to go see that night than to think about trying to talk to people that don't want to hear about a disease that's killing our community. Some of us know how to be good faggots or good dykes and know how to fit in and know how to play the game. And there's some of us who ruffle feathers, and we're the bad faggots. And the bad faggots actually provide a great service to all of the others because they can feel better about themselves. They can feel that they are acceptable. They can work here. They can make a living. They can do things and can get along with everyone.
One night Kurt called me, and it wasn't unusual to get a late phone call from Kurt, but he called me crying, and that was really unusual. It was one of the very few times. We were friends for 20 years, and it's one of the very few times I ever heard him cry. And he had been out, and I guess somebody had been especially harsh, and he called crying, just, you know, wondering, why are we doing this if the people that we feel that we're doing it for are rejecting us for trying to save lives and seek justice. But it was very painful just to have a friend be in so much pain.
Maybe it's getting too existential to say that they betrayed themselves, as we all do. Anytime when you don't present your authentic self, and anytime when you try to silence what you know is the truth and what you know ought to be said.
Kurt's response whenever somebody said, "You're not, you know, what makes you think you can speak for me?" Kurt said, "Speak for yourself. I'm just saying what I feel needs to be said. But if you want to say something else, you know, no one's stopping you. Don't attack me for having the courage to stand up and say something."
A day without art was one of the first actions of ACT UP.
It was a part of World AIDS Day, and it was an international gesture of covering up art, just to recognize the void that had been left by HIV around the world.
And we took black trash bags and cut them up and covered all of the art at several museums here in town. And it was just a way to communicate that so many of our artists were dying or had died from this disease. And it also showed the support of the art community to our plight.
But we had the city cover up them, and they were very, they were helping us until one year they decided they didn't want to do it anymore, and that's when we had action against them for that.
The city of Shreveport decided to, along with SRAC, the Shreveport Regional Arts Council, decided to embellish the Texas Street Bridge in downtown Shreveport with colored neon, and it's now referred to as the Neon Bridge.
They would not participate in a day without art and left the lights on, as I remember.
A number of ACT UP members took a rope and stretched it across the foot of the Texas Street Bridge to block traffic.
Wrapped it around both corners at the end of Texas Street Bridge so the traffic can go in and out.
To get news coverage, to get the message out that what a day without art was and what its significance was.
On May 21st, 1990, ACT UP New York organized Storm the NIH, a national action against the National Institute of Health in Bethesda, Maryland. Thousands of protesters from across the country demanded more treatment options for people living with AIDS, speaking out against long wait times for drug approval and the end of underrepresentation of women and people of color in clinical trials.
We wanted to be involved because this was going to be one of the biggest protests. So ACT UP Shreveport wanted to be represented at the NIH, Storm the NIH.
I didn't know what to expect. It was my first protest.
It was kind of expensive to send a lot of people to Washington, D.C. So, we were always, that's one of the reasons we had all of these fundraisers. These fashion shows were to raise money for us to be able to do these things. I think it was Joe DeSantis, Gary Cathy, Chuck Selber, Bobby Darrow, and myself. This was our first big national protest that we went to. And if I remember correctly, it was my first time ever being on an airplane because I was still quite young. We arrived in D.C. the day before. We went to the Hill and we met with our representatives, and we were lobbying to get people with AIDS added to the Americans with Disabilities Act.
The night before the NIH protest, we had a meeting at a church. I remember that meeting mainly because I sat right next to Ryan White's mother and got to know her a little bit, and that was special for me.
Ron Wayne White was an American teenager from Kokomo, Indiana, who became a national poster child for HIV/AIDS in the United States after being expelled from middle school because of his infection.
There was a time in the program where they asked for each group from the different areas of the country to stand up and shout out their city where they were from.
And everyone was there from very large cities. It was ACT UP San Francisco, New York, Seattle, Houston, Atlanta.
And so, of course, ACT UP New York stood up. Well, that was half the room. And there was a big cheer for ACT UP New York. And ACT UP San Francisco stood up. And that was a great group. And there was a big cheer for that. And L.A.
They went through all of the different chapters, and when we said ACT UP Shreveport, it surprised a lot of people, didn't it?
Yeah. We stood up, and it was just like
four or five of us.
Yeah.
Huge
applause. And the place, there was like no other, because everyone knew that the places that were standing up and being acknowledged were New York and San Francisco and Houston and all the big cities. Yeah. And at that time, there was no smaller city or town in America that had an ACT UP chapter than Shreveport.
For those people who actually had heard of Shreveport, they knew we were in the Deep South and the Bible Belt. And ACT UP then was essentially everywhere.
All of them kind of realized, what they were up against in New York and San Francisco and LA. And they really appreciated that there were some, small little group here in the rurals of North Louisiana that were trying to fight the fight here.
Just like the gay prides in large cities, when you think you're the only gay boy in the world, when a young person goes to a large city, to a gay pride, they feel empowered. And that was the same sense that we got from these large ACT UP protests, we realized that we weren't alone, that it was okay to speak up and speak out.
I think there was a lot of excitement. We knew it was going to be a big protest. All the other ACT UP chapters were arriving, and, you know, we were about to do something big. So I remember there was a lot of excitement, a lot of nervous energy, and, you know, people making signs, and Bobby Darrow sticking Band-Aids all over his face. What was he thinking? I don't know.
Thinking that those Band-Aids would keep a police officer from beating the shit out of me. They would be scared, thinking that maybe I had KS, Kaposi sarcoma, and that I would have these oozing, bleeding lesions, and it would keep me from getting beat up and put in jail. So I could be as rowdy as I wanted to be with my Band-Aids.
Being that there were a lot of gay people in ACT UP, we had a penchant for the theatrics. I mean, Chuck Selber was there the whole day in his hospital gown.
Yeah, this was a big protest. It was, it seemed like thousands of people, police, task force police all around the NIH, with those plastic barrier things.
There was a row of policemen on horseback in front of the main building at the NIH, and but they had all the fencing to keep the crowds back. There was a paddy wagon back behind it, and we stayed there. We were quite involved with everything that was happening, and there are pictures of us still there with the ground littered with trash and things, and just us standing there holding our banner in front of the building.
The larger ACT UP chapters in the country, they were the ones bringing the smoke bombs. You know, some of them had to be pink, of course, and they had the large billboards and signs. We, however, had our ACT UP banner.
The organizers were there not far from us, and so when it was time for them to start bringing the people onto the campus and do the lineup of the demonstration marching onto the NIH campus, they motioned for us to come forward.
Can't remember that we were actually chosen for anything. I think the other ACT UP chapters thought it was cool that there was a DeepSouth chapter there. You know, that there was now ACT UP Shreveport. I think they thought that was cool. And we also had the biggest banner.
They pulled us up into the front of the line, and we led the entire march down in with our little ACT UP Shreveport sign, and with all of the people behind us.
And the fact that they asked little ACT UP Shreveport to lead the protest, I guess because they wanted Middle America to know that it was not affecting just the big cities, that they asked us to come to the front of the line. That made us proud. And especially when we saw it on national news later. We
finally made it back to the hotel room. We jumped in the room and turned on the CNN to see if there was any coverage. And right there, the coverage they were showing were of us with our banner leading the whole demonstration onto the NIH campus. And that package cycled every 30 minutes for the rest of the day with the 5 of us marching with our banner down
ACT UP Shreveport. And so you saw a banner with ACT UP Shreveport and 5 ACT UP Shreveport members, and then thousands behind the signs that say, "We're fired up." And it looks like, wow, there's a lot of people from ACT UP Shreveport.
The huge administrative building we were standing in front of, the people had been in the windows all day watching us, and do you remember that some of them in the windows held up signs that were showing that they supported us? Yes. The people that were in those offices on the other side. And so there was already a sense that the people that were on the insides of those buildings weren't our enemy. And there was they had constructed a double row of fences to keep us from the building. And later in the day, there was a crowd that had built up on the other side of the double fence. One of the people on the other side motioned for Bobby Darrow to come to, I don't know if Bobby remembers this or not, but I'll never forget it. And so he came over to the fence, and I saw one of them reach as far as they could across the no man's land between the two fences. And Bobby was reaching across to get whatever they had to give him. And he walked back over to us, and we're like, what was that about? And he was holding a 4-leaf clover. And we turned back around and we waved at that group, and they all waved back at us. The people in the buildings we were protesting weren't the problem. It was the government officials that were dictating what they could do. And they weren't the enemy, but they were where we had to demonstrate to make our point.
After years of negligent silence, President Ronald Reagan finally used the word AIDS in public. In contrast, the mere possibility of an Ebola infection dominated the news for weeks in 2014. One of ACT UP's most formidable foes was the hypocrisy. ACT UP Shreveport demanded an end to the hypocrisy of religious and political leaders, whose homophobia and bigotry prevented AIDS treatment and research, while contradicting their own sexual orientation and appetite.
Of course, there were also the politicians.
If just the votes in my ward where I voted, David Duke would have won. So that's the context we were in, is that the Grand Dragon of the Ku Klux Klan was winning the most votes in our congressional district, in our half of the state, in our parish, everywhere you looked. That was what was carrying the day, David Duke.
Politicians who are, having gay affairs and then voting against AIDS legislation, and so much hypocrisy.
Shreveport was represented by Louisiana 4th District Congressman Jim McCrary. Representative McCrary had a dismal voting record on AIDS funding for research, treatment, and prevention, which forced Gary Cathy to initiate one of ACT UP Shreveport's most significant actions.
The most radical thing, of course, involves the outing of Jim McCrary.
My first sexual experience was with Jim McCrary, and that was in the summer of '75.
I remember Gary always wanting to expose the truth about Jim McCrary and people in power who were voting and doing things that hypocritical things against people with AIDS and HIV and gays and lesbians.
The outing of Jim McCrary was done by ACT UP Shreveport because of Jim McCrary's voting record, because of his anti-gay, anti-AIDS voting record.
He was our main focus for a while, because his policies didn't reflect his sexual orientation at all.
Jim joined the largest church in the area once he decided to run for national office. He got married once he decided to run for national office.
He was by far too conservative and anti HIV in terms of legislation. And that makes him a ripe target because lots of his constituents were infected.
We were just so angry that this man who was a closeted homosexual would try to use his position to hide that fact and vote against funding for medical research for this pandemic. We had a meeting in that office with Jim McCrary, and he was very intimidated and was threatening to us.
The action to expose Jim McCrary received national attention when an article about Gary Cathy and Jim McCrary was published in the Advocate magazine, exposing McCrary's voting record and his affair with Gary Cathy.
ACT UP Shreveport is one that delivered the press release to Jim McCrary in front of his office the day that the Advocate magazine came out with the article.
And we stood there with the news media facing us, ridiculing us, asking us questions. Once again, we were treated as if we were terrorists.
Some of his supporters came out of the office. It was an election year, and they were interviewed by the press that they just didn't believe that happened.
People didn't want to hear it. People didn't want to know about that. If you don't know about things, you don't have to deal with them.
Because that's what their official statement was, that this political motivation. Like, what what would it help ACT UP? What political motivation would ACT UP have for outing him? It was just to bring awareness of his terrible voting record and the hypocrisy.
And you're out in front of his office in the middle of the day with cameras on you, telling people what he's about. It felt so good.
The outing of Jim McCrary was not easy for Gary Cathy and came at a tremendous personal price to himself, his family, and his friends.
Through my time that I was close to Chuck Selber, I had threatened to run against Jim and use the act of being a candidate against him as the vehicle to out him and to discuss what his votes were doing to our community.
Chuck wanted Gary to out Jim McCrary, and I think, that's a really big ask to ask someone to do, and I think Gary probably needed time to think about that, because that's massive. You're going to out a United States congressman.
I understood why he did. I understood why he hated me for not being brave enough to do what I knew I was supposed to do, because I hated myself. So he wasn't feeling anything toward me that I didn't feel toward myself. In not having the courage to follow through with that, I lost Chuck as a friend. He despised me after that. And that never healed. And he died. Afterwards, I outed McCrary. I finally did what I was supposed to do. Now, I'm trying to be careful not to put words in Chuck's mouth, but I assure you, he is screaming in heaven right now, too little, too late. And fair enough. Maybe it was.
That probably caused a bit of conflict there between Gary and Chuck. I really believe that Chuck, in his heart, didn't hate Gary, didn't hold a grudge.
The bravery shown by Gary was tremendous. And the bravery by his family for supporting Gary was tremendous.
Well, I think it took a lot of courage for me to finally out McCrary and deal with those consequences. That's the most courageous thing I've ever done, is facing the consequences that I knew were going to come because I was going to tell the truth about my first sexual experience with the congressman that was voting for my community to die. There were years of time when people that were my friends here knew that that's what I was saying, knew that that's what I wanted to do, and were supportive of the idea of doing it. It became very different once I did it, and they saw that it wasn't popular what I had done. I became real unpopular, and I lost my community. Everything contracted. People that had been my friends for years would see me in a public restaurant and scream, "You're a sick, tired fucking queen." There's a lot of gay men and women in this town who funded McCrary's campaigns. Were giving money to him. And that bought them some legitimacy, that bought them some acceptance that to be playing the game in Shreveport.
The hypocrisy, because he was a gay man that would choose his position in government over the health of the people of his district and also the health of other gay men.
It's important to make sure that things will be just as good or better for them as they have been for us. That's why I vote the way I do.
He's protecting his money and his power at the utmost, and yes, protecting his closet too.
And I don't know whether it was in reaction to his ultra-conservative constituency or to protect his lifestyle. I don't know whether the man is gay or not, and I don't care. It's just not an issue for me. If that was in fact what he did, he should have been pilloried in a public square.
This man is just evil, pure evil. He has, contributed to the deaths of so many of my friends and to thousands of people who have died of AIDS.
I think that qualifies for murder. Because you put your own personal gain and your own reputation ahead of someone else's life.
I consider Jim McCrary a murderer. I absolutely do.
A legacy of leadership, not politics.
Yeah, I know that Jim McCrary voted no because he did not want to appear in support of people with AIDS or the gay community because he did not want to be outed. That makes him the worst kind of hypocrite, you know, and it makes him negligent. But he's not directly a murderer, but yeah, he is pure evil.
It would certainly seem that if he voted against everything, he wasn't trying to save any lives.
He's a murderer. You can't argue against it. Yes. Yes.
I think that's awfully strong. Anybody who stood in the way of better AIDS treatment, probably could be considered a murderer because people died while they were waiting for care. That's a tough place. I mean, I don't consider myself judge, jury, and executioner. I think it's awfully presumptuous.
As far as I'm concerned, he's an accessory to murder. If I thought there was a hell, as far as I was concerned, he can go to hell. You know, the motherfucker, there were people dying around me.
Yeah, I contend that if the election had gone the other way, the gay community would then have reflected on it as a success. But it proved to so many people that the correct way to go is to keep your mouth shut. If you go by the world standards, it was a total failure. He was reelected and elected again and again and again, and his vote sure didn't change.
People have spoken that, you know, the outing of Jim McCrary was a failure. No, it wasn't. When you speak the truth, it's never a failure.
Jim McCrary was reelected 7 times and continued to vote against HIV research and gay rights issues. ACT UP Shreveport had to confront a culture of relentless right-wing religious conservative control, making their efforts more challenging than in many other areas of the country.
That hole is for exit only, not entrance.
I think that here in Shreveport, there's so much judgment because it's the Bible Belt. You know, there was so much judgment. We were demonized.
The biggest battle, and still to this day, is the religious conservatives.
AIDS was something that we deserved, you know, and it was God's punishment on our community. You know, this was the mentality we were dealing with.
The Christian Coalition was brought here by Reverend McCormick's church, you know.
There's 2 things that were really, really rampant: ignorance and fear.
Oh, absolutely.
That was dealt with to a much lesser degree in places like San Francisco and New York. So I think we just faced a lot of judgment and hatred that maybe they faced also, but to a lesser degree.
People are afraid to act outside of what they're told to. And the religious right is like, you cannot accept people, LGBT community, because God hates queers and you will go to hell. Especially when you have the stronghold and the telling people that AIDS is a disease caused by sin. And that's where people still think that.
The right people were dying, homosexual men.
Gerald called our pastor, and I won't call any names, but anyway, he said to him, I thought my husband was having a nervous breakdown or something. He was just crying and carrying on. Because not that he had AIDS, it was that we thought we was going to lose him. And you remember this, honey? And it was about 1 or 1:30 in the morning. And I didn't know what else to do. I thought maybe he could console us a little bit or something. And you know what he'd said to us? Well, Bill, you know Bobby's going to hell. And didn't you just hang up?
No, I tried to be decent about it and finish the conversation. But he stood steadfast in that vein, and you know, there was no personal support, no
never called and asked us about him or anything. Needless to say, we never did go back to church.
If it was gay cancer, or if it was AIDS, you must be gay, and if you're gay, you're going to hell. So, that idea, AIDS is God's punishment for being gay, that there's still people carrying signs, fewer and fewer, but
there's a lot of delight in telling someone they're going to burn in hell, if that's how your brain thinks.
The service, as it proceeded to unfold, this minister got into about 30 minutes of proselytization and using the death of my patient and my friend to scare people, saying this is too late for him. And so he had led such a sinful life. I sat there so angered and so hurt for that family that had to endure that I cried. I couldn't wait for that thing to be over, that service to be over. I cried all the way back in my car from Natchitoches to Shreveport, knowing I was supposed to go to an ACT UP meeting that night. And when I did, there was some release because I could tell my friends, this is what we're dealing with. This is the kind of stuff that's being told out there.
People are dying. And I was brought up with, by Christians. And apparently I got a totally different message than they did from what was right and wrong.
People who place judgments on other people, judge not, lest we be judged. And so it's a disease. It's not a social statement. People who've had transfusions have gotten it. People who are gay got them. People who are IV drug users.
I'm sorry, but it's just ignorance is the way I feel about it. They just don't have the compassion or something. I don't know what they're lacking, but intelligence is a lot of it.
Despite the constant resistance and discrimination, ACT UP Shreveport continued to fight back. They brought this to Atlanta, Georgia, headquarters of the Centers for Disease Control, where the ACT UP Women's Caucus staged a national action against their narrow definition of what constituted an HIV/AIDS diagnosis.
The CDC could not get their act together on the definition. And I actually participated in a phone call with the CDC at one point in time where they said, well, we're going to say everybody who had exposure to the virus is an AIDS patient. I went, no, you're not. Because there is a natural progression of any illness from viral infection to a clinical presentation. There could be years in between there, and you are not an AIDS patient until you have progressed to have an opportunistic infection, a neoplasm, cancer, whatever. But having HIV infection is simply that. You have a viral infection. And they wanted to include the world, and granted the numbers are horrendous, but they did not. It took them a long time to get to a definition, and there was only going to be homosexual men in their first draft.
Women were not getting certain treatment options that men were. And being also, they were not being counted in the statistics.
Basically, it was still a gay white male disease when all these women and other minorities were getting sick, minority women especially.
One of the slogans was, women don't get AIDS, they just die from it. Because they weren't getting the levels of treatment and benefits that they would get if they did have that classification.
Because let's face it, at that point in time, the CDC was staffed by people who couldn't get clinical jobs elsewhere. And that's a sad comment on the way we were operating. It's gotten some better. In some areas, I think they're top flight, but at that time, people were taking jobs at the CDC because they couldn't make it in the private world.
ACT UP Shreveport didn't have a lot of money. We had a fundraiser, I believe it was again at Euphoria, to raise money so that we could all go to Atlanta.
We rented a large RV that was about the size of literally this office, and there was something wrong with it because when anybody walked in it, it would go like this. So I drove that thing all the way to Atlanta and back with it. I'm surprised we survived that.
And there was a group from the Louisiana School for the Arts in Natchitoches A few students from there came with us.
That protest was a pretty big deal. There was a lot going on in different places in Atlanta.
And we were outside, lots of people locking themselves together, handcuffing themselves together in the rain. And we got a lot of media attention with that as well, with the CDC. So it was another successful action.
The role of the ACT UP Women's Caucus in altering the CDC's definition helped to not only drastically increase the availability of federal benefits to American women, but also helped uncover a more accurate number of HIV/AIDS infected women in the U.S. Under the new model, the number of women with HIV/AIDS increased by almost 50%. In addition to the NIH and CDC actions, ACT UP Shreveport continued to expand their influence outside of the local area, including coordinating a major protest with the ACT UP New Orleans chapter.
When we went to the C100 in New Orleans, Chuck Selber and I went down there, and we were working with a guy, Mark, I can't remember his last name. He was a lawyer, and he was pretty active in ACT UP New Orleans. And, we arranged the arrest of almost, I think it was 50 people or something like that, blocking rush hour traffic to protest that the funding for the AIDS clinic was being cut. We were dragged off into this big van because it was civil disobedience, so we were just dead weight. They dragged us into this van, took us all to the Superdome, processed us, let us go. All of this was arranged ahead of time, so it was very tidy. I remember Mark from New Orleans and I were on the early morning news the day of the protest in New Orleans talking about the action. We were around all the bars every night the week leading up, trying to get that many people to come out and be willing to get arrested. And we were pretty successful because we got 50 people arrested, which was one of the biggest number of arrests, which means you're getting more media attention. ACT UP Shreveport was, it was basically 3 people working full-time organizing that. That was Chuck, myself, and Mark from ACT UP New Orleans. So it was a New Orleans protest, but 2/3 of the people were Shreveport. We had such a close relationship with ACT UP New Orleans that when we had the first ACT UP Network meeting, when the ACT UP Network was being formed in San Francisco, ACT UP New Orleans couldn't send anyone, so they gave us their vote. And so I went to San Francisco with 2 votes. So we had this big room of maybe 20 people from ACT UP LA and all of these people and all these chapters having only 1 vote. And here I was, an 18-year-old girl from Shreveport, having a vote for New Orleans and a vote for Shreveport.
The Holocaust was of special interest to ACT UP founder Chuck Selber, who was both Jewish and gay. He sought to educate that in addition to the Jews, gypsies, and the infirm, the Nazis pursued the forced eradication of homosexuals as well.
Every year, the Holocaust Memorial service was at a different church. So you might be at First Baptist, you might be at the Cathedral or First Presbyterian. I mean, it moves around, still does, moves around to different churches.
And all throughout the presentation, these people were put in camps, the gypsies and the Jews and the infirm, and there was no mention of gays. There was no mention of the homosexuals that were put in there. We were there and we were wearing our pink triangles, and there were probably 8 to 10 of us, and I'll never forget, just here was Chuck Selber, a Jewish man, a Jewish gay man with AIDS, and this moment to remember the Holocaust, the gays were being excluded from it, and he stood up and held up his pink triangle, and just the pain on his face, and that was the most courageous thing. And we all stood up and held up our pink triangle at that, and we just stood and stood and stood there for I can't tell you how long, and then we just left. It was a very, very powerful moment.
The year after Chuck died, it was at First Methodist, and at the end of the service there was just silence, and I remember standing at the door with tears just rolling down my cheeks because nobody was there for the gay people.
Chuck was so
I'm not sure ACT UP would have formed.
Chuck was so important to ACT UP. Without Chuck, I can't even imagine what it would have been like without
Well, he was
Chuck.
his own little
He was
engine that just would send out press releases and make 20 calls that day to stir
Chuck was
something
a
up.
powerhouse.
He was louder than any of us. He was more obnoxious than any of us. I only have good memories of Chuck.
You know, I remember Chuck Selber with a lot of love and compassion, but damn could he get sassy if he wanted to. I mean, he had some spirit to him.
I think that Chuck would have found a purpose no matter what, but I think because it became very personal to him, because he had it, and he was experiencing the discrimination, and because he was Jewish and understood the original Holocaust, that he saw the same things happening, I think he became very motivated.
I'm considered a long-term survivor, 3.5 years. Everyone who started out in my support group 3 years ago here is dead.
He was angry with the establishment, and I think he was angry that things were not moving as fast as he would like to see them move.
And ACT UP has been the best thing for me because there was some system to fight. I can't go in and fight the virus and beat it up, but I can fight the system.
It was like a full-time job for him. Every waking hour, he was reading the newspaper, he was doing his daily research, he was basically running an ACT UP office out of his house because he was so dedicated to do something about it that, you know, nothing was being done.
His mother, Flo, set up the organization for the mothers of AIDS patients, and she was a wonderful calming influence upon Chuck.
We're taught in Judaism that we're here to repair the world, to take care of the sick, to feed the hungry, to clothe the naked, to free the captive. And these are the things we say in our prayer books. And that's our purpose in life.
There were times I spent in his bedroom when he barely felt like getting out of bed, and this little desk beside the bed was a chair where I would sit, and he'd say, "You have to read this, you have to read this." But he wanted to know exactly what you thought as soon as you got through. And he was just a gracious friend. And that's the way I knew him the best.
Was so intelligent and so smart, and he knew that this disease was taking his life. He knew that his time was very limited because of his health.
From the way he lived, I gained a lot of knowledge from the way he lived, the way he felt about people.
And Chuck went real peacefully. I was very happy about Chuck. And that was the one funeral I went to, was Chuck's.
Well, I wrote a column about it afterwards. And all I could think of, and it was the one thing that Michael, the rabbi, didn't say at Chuck's funeral, all I could think of was passion. Chuck Silver had more passion than anybody I've ever known in my whole life.
He was so courageous, and I think that maybe one of the reasons I'm courageous.
He was like, Ashley, as soon as I get better, I'm going to take you to the movies. And then I remember he would always say that, like every time he would get sick. And right before he passed, I remember he said, "Ashley, I don't think we're going to make it to the movies." And that was his way of like telling me that he,
I only have good memories of Chuck. He was possibly awkward at times in the way he handled things, but his heart was in the right place.
He challenged a lot of us to maybe get out of our comfort zone and to do things with him that we wouldn't have done or we wouldn't have led on our own.
I went to Strong's for lunch. It was a Sunday, and came back, and I had called the rabbi to, it was getting close that he needed to come, and the rabbi and my husband were there, and I went to lunch, and he died while I was gone. And I felt very badly about that. That bothered me for a long, long time, that I was not there when he died. But my daughter-in-law said something very, very astute. She said, "Mother, you were with him when he was born, and Daddy was with him when he died." So that's what helped me get through that bad time.
It was through the efforts of ACT UP Shreveport, Dr. Mark Spurlock, and their allies that the Philadelphia Center was founded as Northwest Louisiana's premier HIV/AIDS resource center, serving thousands of men, women, children, and their families living with HIV/AIDS.
The Philadelphia Center, Northwest Louisiana's AIDS Resource Center, came about as a result or was an outgrowth of ACT UP Shreveport.
And I couldn't get any space from LSU for the Philadelphia Center. They wouldn't work with me. And I was told by a very prominent doctor that I would learn. I learned. I got it from Schumpert with a fight, but they were a Catholic hospital. They sort of had to help.
He was the founder of the Philadelphia Center. He saw that Ryan White was coming along, that money was going to be allocated through the Ryan White Emergency Care Act, and he was prepared. He wrote a grant to receive part of that money for North Louisiana, and we got it, and we formed the Philadelphia Center as a result of it. We had to work within the system all of a sudden, and I became the executive director of that organization at the request of my doctor, Dr. Mark Spurlock. And I had a business background, and he needed someone.
Philadelphia Center building that they're in now is named the Bobby Darrow Building, and it's very deserving. Bobby was there within the year of its opening, and he came in as executive director.
Bobby had fought the state HIV group more than anybody. He was in there fighting. And that group had some evil people in it that really wanted control and power and were furious with Bobby because we got that $1.3 million. And they said they weren't going to work with us at all as long as he was head.
The state was heard saying that I was too close to the problem because I was a person living with HIV and AIDS, and that I had no business being in that position.
That was pure evil. But Bobby very graciously said, I will step down if it means that we get the money quicker and we can move this thing forward. And I totally disagreed with Bobby. I said, this is the wrong thing to do because that they're doing stuff to us to punish the people that have fight so hard. And I'm not going to stand for that. And Bobby says, I don't care. I want the clinic to move forward and we need the money. So he stepped down.
I sued the state. We settled out of court. I won. And it was quite a battle between DHH, the Department of Health and Hospitals here in Louisiana, and many trips down to Baton Rouge to get that resolved.
Of course he sued successfully. It was complete and utter crime that they were committing. One of our biggest expenditures in the beginning of the AIDS era with the Philadelphia Center was how do we help people buy medicines? I mean, you totally bankrupt the Philadelphia Center buying one prescription for somebody. So it was horrifying, yes. I did work every angle I could to get them free medicines, but eventually we got the viral disease clinic set up, and I'm sneaky. I got in there and I got every medicine I could get in that clinic. I got birth control pills, I got blood pressure medicine, I got everything in that clinic because these patients needed help. Eventually the state came and slapped my hands. Dr. Block, you know you were not supposed to have those medicines in that clinic. I said, I'm sorry. It's always easier to ask for forgiveness than permission. And I did it over and over and over, and I got away with a lot of crap because I had patients to take care of. And I got everything I could while I could.
I see ACT UP Shreveport and the Philadelphia Center as one. It was a continuation. It just moved from working from the outside to working within the system from the inside.
See, in my mind, the Philadelphia Center and ACT UP are the same thing.
Same here.
Because everyone that was part of ACT UP worked at the Philadelphia Center.
And they said, oh, the gay clinic. I'm like, I wish somebody would tell all these straight people that are coming here this is a gay clinic because they must not know, you know. Because people say, oh, it's the gay clinic, it's the gay clinic. And I'll be like, almost everybody that comes here is straight, but okay, you know, but it's convenient when And that's fine. The gay people, I think we are fine with taking up the cause, and carrying the torch and being the ones to speak up.
The Philadelphia Center has now served thousands of people, not only those living with HIV, but their families, their children. We have had young children living with AIDS come through the Philadelphia Center. They have died. We've attended those funerals. I have no regrets, not a one.
Fuck no.
No regrets for having done what we did. No. It's part of my history that I'm very proud of, and I imagine you guys are as well.
I like to say I wish I could have done more, but I don't know what that would have been, I guess.
It's definitely part of my identity. Those of us that are still here are going to fight till there is a cure. Everyone I know in ACT UP Shreveport that is still here, they're going to fight till there's a cure.
The contraption of a name that Larry Kramer came up with, AIDS Coalition to Unleash Power, is a mouthful. And it kind of says what we're about. But there was the logo that had on it silence equals death. That's, to me, what ACT UP was. That encapsulated everything. It was the silence. And the most we hoped to do, really, was to try to do what we could, where we could, when we could find the courage to fight that silence.
That's the lessons we all need to learn. We're going to have other problems like this in the future. And we need to learn from this one for the next one. The Jews, the reasons they've taught us so much about the Holocaust and why it keeps coming up is there's one thing that I've learned from that. I finally figured out what they're trying to tell us. Because you're good people doesn't mean they will take care of you. They will kill you by the millions. You have to not ever let them take one little slippery step down that slippery slope. You must attack them every time they make a move. They try to go down that path. And we should have learned it from here. And ACT UP was what that was about.
ACT UP was a means for giving, it's obvious, for helping people that needed help who were being ignored. And I think when you start making the compassionate choice, the choice to be compassionate and loving towards your fellow, when you realize that all men and women are your brothers and sisters on this planet, ACT UP seemed like the right thing to do.
I think that's what we all need to do. Be who we are and stand for what we believe in as long as it doesn't hurt anybody else.
And it's just as important today, I think, as it was 25, 30 years ago.
I don't think that I was ever involved in an action or that I heard about an action, whether I participated in it or not, that didn't make enough statement to affect one or two people at a minimum. And that was the way I always looked at it. If we change one mind, we've done something that's worth it.
If you judge ACT UP Shreveport by that criteria, then yes, ACT UP Shreveport was very much successful.
And these guys are my heroes because, to my knowledge, they're not infected, and everyone else was. So I love you guys.
We share history together, a history that was such an integral part of our lives.
That group of people found a way to put information out there, put themselves out there, and that did change things.
And we've made a positive, no pun intended, impact on thousands of lives, and all of that had their seed in ACT UP Shreveport.